Next up, I'd like to introduce Dr. Paul and Brandy, who are frontline healthcare workers here in Woonsocket.
As Alex said, my name is Dr. Paul, and this is
Brandy.
and we are frontline health workers, and we're here because as health workers, we each took an oath that we would advocate and protect and serve our patients, and what we have seen is an all-out emergency. This is nothing like anything I've ever seen before anywhere else I've worked. Every week, I'm meeting patients who are telling me that there's a really high chance that they could lose their housing just within the next week. This is an ongoing rolling crisis, and winter is now here. That's unlivable, and it's been crazy to see how housing has not been talked about by the city council and the mayor at all. The mayor sent a survey out to the community. The mayor asked the people what they wanted. The people said that they wanted housing. And do we see any housing in any of the money that's been sent out?
No!
This cannot keep going on. We are the people. This is a democracy. This is why democracy thrives. It's when we come together and we show our collective will. As a doctor, people oftentimes try to kind of talk about people who are unhoused as though it could have been their fault, and so what do we really need to be doing to help them out? But that's just not the case. These are all myths and lies. These are our people. These are our brothers and sisters. We need to care for them because this can happen to us, and we all have to stand together. I'm going to pass it on to Brandy.
All right. So I'm actually coming back into the city. I was born and raised here. And it's disheartening to see what the city has become. To see so much homelessness, and not just homelessness, but lack of empathy for these homeless human beings. We see it on a day-to-day basis in the healthcare system where they're going to lose their homes, or they have lost their homes and they're living in their cars, or they're popping from motel to motel. When I read the story, I'm kind of reserved, but I'm passionate. So when I read that story about so much money on a skating rink, yes, I understand that the youth need something to do, but we need to get rid of the homelessness first. We need these people to have a warm, safe place to sleep and be able to sleep without stress and not worry about how are they going to get to their doctor's appointment to treat their high blood pressure or their depression, because homelessness is a co-occurring disease. What is it?
It's a co-occurring disease,
Yeah, it's a co-occurring disease. Lack of housing, mental health, physical health. How can you take care of your physical health and mental health if you don't have a place to live? For me, and I'm very passionate about the community here, being back in Woonsocket and seeing these patients that I have known for years. I only can do what I can do. And whatever I can do, I will do it. And if it's speaking, I will do that. If it's supporting, I will do that. If it's buying a hamburger, I will do that. Whatever I can do to help the people that are struggling in this city, I will do it 100%.
Stay with me. Housing is healthcare. Housing is healthcare. Housing is healthcare.
Housing is healthcare.
Thank you both so much. Can I get another round of applause? Woo! Woo!